As you know, we've been working for several months on a statewide expansion of the managed care delivery model for Kentucky's Medicaid program because we believe that the private sector could bring efficiency and innovation to the Medicaid program. I'm excited to announce today that this week we formalized that expansion by awarding 3-year contracts to 3 managed care organizations and renewing an existing contract. As a result, we expect to save taxpayers $375 million in general fund dollars and $1.3 billion in overall funds over the next 3 years in the Medicaid program. In the process, we will rebalance the Medicaid budget this fiscal year using Medicaid funds, as I promised to do, improve the delivery of services and thus health of Kentuckians, and create nearly 550 new jobs in Kentucky, which these companies will need by January 1 to administer their new contracts. 3 of the contracts are with managed care organizations that are new to Kentucky. They are Coventry Cares of Kentucky, a Medicaid product of Coventry Health and Life Insurance of Delaware, which provides services in 8 states. Kentucky Spirit Health Plan, a subsidiary of Centene Corporation, which is based in Missouri and provides services in 12 states. And WellCare of Kentucky, a part of WellCare Health Insurance of Illinois, which provides services in 7 states. Come October 1, those 3 organizations will begin coordinating physical, mental, and dental care statewide for more than 560,000 Medicaid recipients all across Kentucky, except for the region which is currently covered by Passport services. Passport, Kentucky's only existing managed care provider and the 4th organization, has had its contract renewed. Passport has been providing services to 170,000 Medicaid recipients in Jefferson County and 15 nearby counties for more than a decade. Its work has proven the effectiveness of the managed care model. Yes, there have been some recent problems with the management of Passport, problems that I worked with Kentucky's auditor and a new management team to root out and fix. But as we all know, these problems were with the former managers and not the managed care model itself. Passport provides good care, and there will be no break in service and no break in coverage for its recipients. Taxpayers can also rest assured that we will have strong oversight over the work of all of these companies in Kentucky. We have built strong consumer protection provisions into the contracts, and as you know, in January we created a new Medicaid managed care oversight branch. We will make sure that taxpayer dollars are well spent. We look forward to building the strong partnerships with these organizations that can make Medicaid both more efficient and more effective. There, of course, will be bumps in the road as we implement this model, but we will act quickly and aggressively to smooth those bumps out. We see this as the beginning of a long process of change. And let me be clear, we believe the benefits will not only be financial, but they're also going to be medical in improved care for Kentuckians. The goal of managed care is not just to lower overall cost, but to also improve outcomes, reduce unnecessary medical services, and promote wellness and healthier lifestyles. The emphasis is on prevention as well as coordination of care. It's the model that most other states have either adopted or are moving toward. 20 states expanded their managed care programs in the last 2 years, and 19 have indicated they will do so in this fiscal year. Some 46% of Medicaid caseloads in this country are under managed care. If you recall, this issue came to a head last fall when funding help from Congress fell $100 million short of expectations built into the General Assembly's 2011 Medicaid budget. Facing the real threat of having to severely cut provider rates late in the fiscal year, including in our rural communities, we developed a plan to fix the 2011 deficit with money from the 2012 Medicaid budget, and then rebalance the 2012 budget with anticipated savings from managed care and other efficiencies. That plan was finally approved, emphasis on finally approved, during the special legislative session in March and April of this year. The contracts we're announcing today show in black and white that those savings are for real. Our plan prevented damaging cuts to classroom education, higher education, public safety, and other important services in fiscal year 2012, as some had advocated. We and many other people considered those cuts unnecessary, as well as ill-advised. In the past couple of years, we have cut some state agencies by up to 30%, while cutting more than $1 billion in state spending. In addition, the savings achieved with this new delivery model will alleviate future pressures on the general fund from Medicaid, allowing us to preserve funding for priorities like education, creating jobs, and public safety. Now, let me recognize the people whose hard work brought us to today's announcement. First, Secretary Janie Miller and her entire team at the Cabinet for Health and Family Services. Janie, you guys have done a magnificent job, and on behalf of all Kentuckians, I want to thank you very much. Next, Mary Lassiter, who is not only Budget Director, but also Secretary of my Executive Cabinet. And an essential part of her team was Don Spear of the Financial Cabinet, who oversaw the complicated procurement and contracting process. Thanks to both of you for your hard work. Folks, what their work and today's announcement reiterates for all of us is that there are two ways to fix an unbalanced budget. You can use a meat axe and rush in and blindly chop and slash, but then you wreck programs and services, hurting the people who rely on those programs and services. Or you can use a surgical knife to strategically cut waste, protect what's essential, and with the help of innovative ideas, create a fundamentally more efficient structure that pays off for years to come. That's the smart approach, and it's the approach I'm taking with Medicaid. Today we prove that if you're strategic, you can protect both the taxpayers and critical services.